name is Noemi Perez, and this is my video for the heart, neck vessels, and peripheral vascular system. This is my patient today. I have her laying on this bed, which we're going to use as the exam bed. If this was a real life situation in a real exam room, I would have already had her change into a gown. I would have already have collected the subjective data, her health history. I would have already explained the procedure, gained consent, and answered any questions that she had. Okay, so first I'm going to assess the neck vessels. I'm going to stand on the right side of my patient. I'm going to have her lay supine, which she already is, or like on her back. I'm going to have the head of the bed raised 30 to 45 degree angle, and I will begin by observing the jugular venous pulse. I'm going to have her turn her neck to the right and then turn her neck to the left, and I'm going to feel on both sides. Turn your neck. Okay. Okay, so next I am going to inspect the suprasternal notch in the middle of her neck. Okay, good. Now I am going to evaluate the jugular venous pressure. I'll be adjusting the head of the bed from 30 degrees to 45 to 60 to 90 degrees, and I'm going to be assessing for distension in her jugular venous. Okay, so we're already at a 30 degree angle. Okay, I'm going to put you at a 45 degree angle. Okay, 60 degree angle. Okay, and now 90 degree angle. Okay, so there was no distension or bulging noted. So now I'm going to go ahead and osculate the carotid artery. I'm going to osculate before I palpate. I'm going to start by cleaning my stethoscope with alcohol wipes and warm it so that it's not cold on my patient's skin. So I'm cleaning the stethoscope and warming it. So I'm going to have my patient turn her head to the side. I'm going to ask her to hold her breath and let it go when I tell her to. I'm going to do both sides of the neck one at a time. Hold your breath and let go. Hold your breath and let go. Okay, so I didn't hear any brewing going on or any abnormal sounds going on. So next I'm going to palpate the carotid artery one at a time. You never want to do both of them at the same time because you don't want to occlude them and cause your patient to pass out or have any kind of problems like that. So I'm going to palpate. Okay, so they are both equal and strong bilaterally. So next I am going to inspect the internal portion of the chest. So in a real life clinical setting, I would have already had my client remove the gown from the upper part of her chest. And I would be looking for any pulsations, looking at the apical impulse area, looking for any abnormal vibrations, for any kind of skin changes to the chest area, and but in this situation I'm not going to have her remove her gown since it's going to be on YouTube, and I'm just going to pretend that she has it off. Okay, so I'm going to inspect her chest. Okay, inspecting. Okay, so now I'm going to palpate the apical impulse. So in a real life clinical setting, I would have my patient lie on her left side. Go ahead and lay on your left side. and feel for it that way. So it will be located in the mid-clavicular and the fourth or fifth intercostal space. And once I'm done palpating for the apical pulse, I'm going to use the palm of my hand to palpate for any abnormal pulsations and vibrations. So, mid-clavicular and fourth, fifth intercostal space. Okay, so no abnormal vibrations or pulsations noted. So now I'm going to oscillate the heart rate and rhythm in a real life clinical setting. I would listen to the heart rate for a full minute, but to minimize this video time, I'm going to oscillate for 30 minutes, and then I'm going to times it by 2. Now, if I notice any like abnormal sounds or rhythm, like beat skipping, I would then listen for a full minute without doing the 30 minutes, because I want to listen to see how many times that's happening, and I would need to get like a full count on her heart rate. So I'm going to take a listen. Okay, so her heart rhythm is strong. It is 85 beats per minute. It's a regular heart rhythm. There's no abnormal rhythm going on. There's no abnormal sounds going on. So now I'm going to oscillate for the S1 and S2, which is the love W here when you're listening to the heart sounds. So the S1 is towards the bottom area, and then the S2 is more up towards the top. So I'm going to head and go take a listen. Okay, so S1 and S2 are present. So now I'm going to go ahead and inspect her arms. I'm going to be looking at the size, making sure they're the same length, making sure they're symmetrical. I'm going to be checking for edema, for color, for any abnormal skin textures going on, any abnormal moles, bruising, anything like that. So I'm going to have her hold her hands out with her palms up. If you want to sit up on the side of the bed, you can, or sit up in the bed, you can. So I'm going to have her hold her hands out with her palms up. Okay. Okay, so size is symmetrical. I don't see any edema going on. The color is normal for her skin tone. So now I'm going to palpate her arms and her hands and her fingertips, and I'll be checking for capillary refill by pressing on the fingernail for 3 seconds and letting go. I will also be checking for temperature using the back of my hand And I'm going to be asking her if she's having any pain or tenderness. Okay, calculate in. Any pain or tenderness? No. Checking temperature. Turning hands. Don't turn your hands. Okay, so temperature is warm to the touch, which is in normal limits for my client. Capillary refill was less than 3 seconds, and I didn't feel any abnormal masses in the arms. I didn't feel any. I didn't feel any abnormal nodules or anything like that going on. So next I'm going to populate the radial pulses on both. Populate the radial. Okay, so both are equal and strong. It's normal, which will be a rating of a 2+. Next, I'm going to check the ulnar pulses with 3 fingers this time. So put your hands out, and it's going to be on the pinky side. Okay, so both are bilaterally strong and equal. So next I am going to palpate the brachial artery, which is in the crease of the arm and in the front of her elbow right here. So I'm going to go ahead and do that. Okay, so they are bilaterally strong and equal. So next I'm going to palpate the nodules, which are the, let's see how I say this, epitroncular nodules. So I'm going to have her shake my hand as I feel between the bicep and tricep. Okay, so did you have any pain or tenderness?
No.
Okay, so she states she had no pain or tenderness when I was feeling. I didn't feel any abnormal nodules in the area. So now I'm going to perform the Allen test. So I'm going to have her sit up and put her arms on the table. I don't have a table, so we're going to pretend. With her wrists and her palms up and make a fist. So we have a table here. She's sitting up with her palms up, and I'm going to have her make a fist. And I'm going to include both the radial and the ulnar pulses at the same time. And when I tell her to let go, I'm going to be observing for when the color comes back to her hand. So I'm going to do this one at a time, so you can put that one down. Whichever you want to do. So I'm going to do these one at a time. So squeeze your fist, and I'm going to include both of them at the same time. Okay, let go. Okay. Okay, so the color changed back within less than 5 seconds to its normal color. The color also changed to like a pinkish rose color, which lets me know that both her radial and her ulnar pulses are patent. So now I'm going to move on to her legs. I will be inspecting the legs for color, edema, symmetrical temperature, any abnormal lesions, any abnormal skin problems such as moles, warts, boils, anything like that. So I'm gonna have her uncover, and she would be in a gown, so I'd be able to view her legs. So I'm looking at the her legs. Okay, her legs are both normal for her color, for my patient's color. I don't see any edema going on. I don't see any abnormal lesions, any skin problems. Her legs are symmetrical. They are like the hair on them is distributed evenly, so I don't see any problems with her leg area. So now I'm going to palpate for edema, noting any fluid retention or pitting. So. Okay, so I didn't feel any edema or any pitting noted. So next I'm going to use the back of my hand to palpate for temperature. Okay, so the temperature is within normal limits. The temperature is warm without any moisture noted. And it's normal for my client's body heat. So next, if this was a real life clinical setting, I will palpate the inaugural lymph nodes and osculate the femoral pulses. But since this is a video and I don't want to expose my daughter on video to that, I'm going to show you where I would palpate for that. So I would have my patient on her in her supine area. I would be palpating myself so that I can show you guys, I guess. So it would be right up in here in the medial thigh. I would be palpating for tenderness and for any abnormal lymph nodes like nodules. Okay, so there's no tenderness, nothing like that. So I will palpate the femoral arteries, which are here at the top of the leg, right up in this area. So I'm going to be checking amplitude, making sure they are even and strong. And then after that, I would osculate them with the bell of my stethoscope, listening for strength and rhythm. After that, I will be palpating the pulses down on the back of the knees. So that's the palpatile pulses, which are in the back of the knees. So you lift up your knees. I'm going to palpate them on the back of her knees. Just put your legs up. Or you know what, you can stand up a little bit, maybe, and we can palpate that way. Yeah, just stand up. So I'm going to go ahead and palpate the pulses behind her knees. Turn towards me. Okay, so both of them are bilaterally strong and even. So next I'm going to palpate the distal tibial area, which is on the inside of the ankle on both sides. So you can go ahead and lay back down and just put your knees up so I can reach your ankles. Okay, so both they are both bilaterally strong and even. So next I'm going to palpate the dorsal pedis pulses, which are on the top of the feet. So let me do that. They're going to be right up in here. Oh, these are strong. Okay, so both of them are bilaterally strong. Palpate the amplitude at 2+, which is normal. So next I'm going to check for the capillary refill on the toenails. I'm going to just pinch the top of the toenail and see how long it takes for the color to come back. Okay, so the capillary refill was less than 3 seconds, which is normal. So next I'm going to check for varicose veins and thrombophlebitis. So I'm going to have her stand up and inspect the veins on her legs. So if you can please stand up. Look on the back. Okay, so there's no redness, no bulging veins, no varicose veins noted. There's no abnormal color to her veins. So next, I will do I'm gonna do the positioning change test. Starting in the supine position. Can you lay flat? Okay, so I have her laying flat and I'm going to lift up both of her feet, going up and down for 1 minute. Then I will have her sit on the side of the bed and dangle her feet and check when the color comes back. So let's do this. Okay, so you're gonna have your feet go up and down. Okay, we're just gonna say for video purposes that was 1 minute. So now can you sit on the side of the bed and dangle your feet? Okay. So the color comes back normal. The color is within normal limits. It returned within 5 seconds. So that was it. Thank you for watching my video, and this concludes it. Thank you.